President of the National Association of Resident Doctors, Dr. Okhuaihesuyi Uyilawa, says the strike has become unavoidable after the expiration of a 113-day ultimatum earlier issued to state and federal governments to address pending issues, including welfare. The group accuses the federal government of insincerity in implementing its promises to resident doctors as contained in the Memorandum of Actions signed before the ultimatum was issued. We're now joined by NAD President Dr. Uyilawa. Thank you very much for joining us on the news. Straight up, the COVID-19, we now have the Delta variant, and we know that the numbers are increasing. Some persons would say this is not, it's never a good time for doctors to go on strike. What do you usually say to these sentiments?
We lost 19 of our members to COVID-19. Most of our members are human beings like any other Nigerian, and they tend to have to take care of their own family welfare. Some have not been paid for 18 months, means they cannot even beg any person to stay in the place without paying their rents. Their children attend schools, which when they are driven away from schools, you cannot tell them that because you are a doctor, you're not able to afford it. There are needs that a doctor normally needs to at least to function as being the breadwinner in their house, which they cannot be able to stay with. COVID-19 infection has been on. The Delta variant is back now. But which is worse, hunger or the COVID-19? So many Nigerians are hungry today because they are still in the poverty level and cannot afford to take care of their welfare. So the hunger kills more of our Nigerians than the COVID-19.
Okay, I want to ask you this question. Like a lot of Nigerians, we would like to know, is it that there's been no communication between the resident doctors and the federal government in the time that this strike has been, the suspension has been on? Or is it that conversation has been ongoing, but there doesn't seem to be an agreement? Let's see if we can understand that a bit.
2 weeks ago, 2 weeks Thursday, where health, the permanent secretary, we are available. We have written them as a reminder that we have from the 26th to 30th of July. But as it stands, actually everything, nothing has been done. Payment people are still being, and nothing has been done about payment of salaries, only promises. Embargo, there was an embargo by the and said that those on the non-regular stopped and the centers verified for over 3 months now, and about it. Everybody goes to sign the Memorandum of Action at the ministry where the of health were giving faces and impression as if same thing for the first time. Doctors is what we have asked for over 10 decades. And we do not need to go on this strike if some people and do what they are supposed to do.
Quite an unfortunate development there. We're hoping for the best. We're hoping that the federal government will listen to you this time and take into consideration the many patients who require your care. All the best of luck, Doctor. Thank you very much, Dr. Uyilawa, for speaking to us.